I'm going to get started. So it is 7 p.m. on Tuesday, June 9th. This is a special meeting of the Town of Hamilton Board of Health, wherein we are going to depart from our usual format, and tonight we're going to hold an open town forum on the subject of COVID-19. But first, I want to go through some formalities. So we're officially opening the meeting, which is taking place on Zoom, and we'll introduce ourselves. I'm David Smith. I'm the chair of the Board of Health. Other members?
I'm
Dr.
Christopher
Perez.
Small. Yeah,
Okay.
Christopher Small, member of the Board of Health.
Dr. Giselle Perez. I'm also a board member.
Christine?
Christine Lee, public health nurse.
Okay. I think we also have Ray. Could you introduce yourself?
I'm Ray Burnett, Hamilton Fire Chief, also the Emergency Management Director.
Okay. Is Russ on? Okay. And I think Joe is present and in a listening mode right now. So
that is true.
Thank you, Joe. I think we're ready to start. What we're going to do is tonight ask our residents to ask any questions they might have about COVID-19. And if we have a lot of people participating, what I'm going to ask you to do is use the comment feature on Zoom to pose maybe in 3 or 4 words, just the topic of your question, and then we'll just take them in sequence, one by one, as they come in. And that way, when you post a couple of words of your question, then I can identify who you are and what the subject is, and that way I'll be able to say, so-and-so, please ask your question on the subject XYZ. And that way we'll be able to keep some organization to the call. So let's see. I'm looking to see, for those of you who are new to this, at the very bottom of your screen, you'll see some icons. On the left-hand side, there's a mute button, for example, and right in the middle, there is a chat button. And if you would like to pose a question, just click on the chat icon and write a couple of words that convey the subject of your question, and then we'll ask you to come on and speak. So anyone, let's open it up. Anyone have a question they want to start with? Tell you what, let's let people collect their thoughts. Christine, could you update us on what I call the numbers, the COVID-19 numbers for Hamilton? Let's start there.
Yes. For the confirmed cases, we have 36. For the probable or the antibody positive, we have 3. We've had 7 official deaths, meaning death certificates have come to me. And then we have 4 people that we are currently tracking that are either a positive case or a contact of a positive case. So 36 confirmed, 3 antibody positive, 7 deaths, and 4 currently in progress that we are in contact with.
Okay. Anyone on the call have questions about what Christine has just said? Okay. Let me continue. Now, some more information about where we stand. I've been following these numbers pretty much on a daily basis. And the really good news is that in Essex County, and as well really in the state, what we're seeing is day to day, for the last 2 months, since the middle of April, where we hit peaks, we've seen a steady decline by anywhere from 50% to 80% in the number of positive cases of COVID-19, the number of hospitalized patients with COVID-19, the number of deaths. Today, in fact, I think, if I recall correctly, I saw the number of people who have been officially recorded as dying as a result of COVID-19 is either 1 or 2. And that is incredible considering the fact that a month or 2 ago, the number was way up in the high hundreds. Then further good news specifically to Hamilton is that as of last Wednesday night, when we have the latest official reporting by city and town, Hamilton and Wenham together have among the very lowest per capita rates of COVID-19 positive infections in the entire eastern half of the state. And the numbers continue, those per capita rates continue to be really low, which I think is a testament to how well our residents have listened to, taken seriously, and acted on all of the kind of the public health education work we've been doing to help our town stay safe. So I think that's wonderful news, and I hope it continues. So, all right, someone has put a question on the chat, I think. Let's see if I can. All right. Oh, from Joshua. Josh, could you turn your speaker on? In other words, unmute your device and pose the question about community spread in Hamilton. Josh, are you there?
Yes, I am. So I was just following up on Chris's numbers, and I know in past weeks she had said that a lot of the cases were not strictly, but unfortunately healthcare workers. So I didn't know if there was any, since the numbers have increased, if it was more cases of spread within our own community.
Okay. Hi, Josh. So there are intermittent cases that occur every now and then. Primarily, it's healthcare workers or individuals that have previously been ill. But initially, we had very many cases that were or I shouldn't say very many. The initial numbers were very intermittent. It had been travelers or people who were collecting their child from college. People primarily knew where the infection, where they had acquired it. They had a relatively somewhat of an idea of where they had acquired it. And then at the end here, we've had primarily
there's a
healthcare workers.
Chris, I think you should continue.
Chris, you've muted yourself. Christine?
I think, yeah. I think
Okay.
she's trying to unmute.
I'll call you tomorrow. Okay. All right. Bye-bye.
That's better.
Okay, has that answered the question? Someone had asked regarding, are the cases now healthcare workers? Was that what they had asked?
Well, Christine, the question that Josh posed here, is there any evidence of community spread in Hamilton? That's a good question.
And may I interject, Chris, when you answer? I think it would be helpful
Please.
to also define community spread, because I think that's another layer of confusion.
Right.
So community spread, meaning neighbor to neighbor in a specific area. Yes, we did have a bit of a community spread. Within 48 hours, we had 4 cases. And what was occurring in this situation, people were trying to be extremely neighborly, feeling as though a friend could check up on another friend's mom who was not well, and really trying to provide for their neighbors in such a caring way that the protocol of purchasing groceries, for instance, and leaving them on the doorstep, or once inside making a very brief visit with a mask and gloves, people were feeling that it was, how do I say, off-putting to do this to a very close neighbor, and thereby they spread the coronavirus to 4 people in a community. And then there was a healthcare worker that was involved. So although it was part of the community, I don't believe that it was directly related to the initial incident.
But I think, but a really great question, though, I think underlying all of that is this issue of community spread, and distinguishing that from other factors. And when we think of community spread, it's essentially person to person within a set place, as opposed to traveling from outside within. So that being one factor to keep into consideration when you're thinking about how the virus is spreading.
Absolutely.
Can I ask just to confirm that there was only one incident of that in town? So town-wide, community-wide, there is no evidence of community spread in Hamilton at this point.
Correct.
And Christine and Joe, and I think, again, confirmation of that is that we are seeing such a low per capita rate of COVID-19 infection among Hamilton residents, because we're doing a very good job of respecting the guidance and the kind of the rules under which we've got to try to live these days. So our town really deserves a lot of credit for keeping that number so low and preventing community spread, as it's called.
I do want to kind of emphasize that, because I think there's I want to make sure we go to the next question, but where I want to highlight is in those occasions where that ability to separate and create distance is more difficult, and we are seeing greater community spread. So places like Chelsea, where there's a lot more difficulty, we know has been heavily hit. So I put that out there because I do want to provide that comparison. When you're in a place where the population density is that much greater, and there's more difficulty of creating more of that physical distancing, then you're increasing the risk of having that issue of community spread. Here in Hamilton and Wenham, we have the resources to provide that ability to maintain physical distancing, and also people are complying with wearing masks, and therefore we have been able to maintain those rates quite low.
Thank you, Dr. Perez. Okay, the next question is from Erica. Can you share the age range of those who have passed away? I guess, Christine, you're the only one in a position, if you can answer that question, to be able to do so.
The age has ranged from 79 and above. Primarily, the people have had an underlying illness.
Okay.
And just to voice this, I do not know of anyone's underlying illness. So if I do make a call to a resident, the only piece of information that I know about the person's medical condition is their positive communicable disease. There could be a host of things. There could be surgeries. You could even currently be in the hospital when I call you. I know nothing other than your positive communicable disease.
And Erica, a follow-up on that. From all of the detailed data that the State Department of Public Health publishes every day, what I can say is this. Of all of the, I think it's about 7,300 people who have died from COVID-19 in Massachusetts, about 60% have been in nursing homes or long-term care facilities or that kind of a setting. About 98.5% of them have had pre-existing conditions like diabetes, cardiovascular disease, lung disease, and so on. And when you look at the age ranges of those who have died from COVID-19, by far and away, the highest age cohort is between 80 and 100 years of age. That's a huge spike when you look at the distribution. From, if you're younger than 80, the odds of your dying from coronavirus are very small. And if you're over 80, the likelihood goes way up. So if you're over 80 years of age, if you're in a long-term care facility, and if you have a pre-existing condition, then that is that's a very bad situation for you if you contract coronavirus. So I hope that answers your question, Erica. A question from Deb. Is social distancing really necessary when wearing a mask? There's an interesting question. The social distancing and wearing a mask. Let me take a stab at starting to answer that, but Dr. Perez and Christine, I'd like you to weigh in on this question. The state's guidelines are heavily based on what the CDC guidelines spell out, and it is expressed in Governor Baker's order. If you are out of doors, you do not have to wear a mask if you can stay at least 6 feet away from everybody else, excepting members of your own household. If you put aside members of your own household for a moment, from the moment you walk out the door, you don't have to wear a mask if you're outdoors and you can stay 6 feet away from everybody else. And as you probably know, our Board of Health issued an order that if you're indoors in a business or commercial establishment or that kind of thing, you must wear a mask. So is social distancing really necessary when wearing a mask? Dr. Perez, let me ask you, so if you, let me take the question and pose it in a different way. If I'm outdoors and I'm wearing a mask, if I put a mask on when I walk out the door, do I have to try to stay 6 feet away from everybody when I'm outdoors? What do you think?
So I think as you're describing, there are many different layers to that, right? Because then you add quantity, how many people are together? Are you inside? Are you outside? Is there, so, and also masks are limited. So they're helpful and they do protect. That's why there's a, to a certain extent, given how the transmission is expected through droplets transmission, the mask is helpful, but there is no 100%. So I think when you're thinking of risk increase, the more bodies you have in close proximity without a mask, there's a higher likelihood of there being a transmission. And I think that's why you're seeing the numbers being limited, albeit it might feel arbitrary, but it just comes down to greater numbers suggest greater risk of something happening. So I think that's why it's not a straightforward answer, because it depends on the multiple layers. But something like, for instance, being outside, right, especially in our community, if you're able to maintain physical distance outside because of just the environment, the open environment, wearing a mask is not going to be as necessary because you're distanced, right? So in essence, there's a harder time for the virus to jump from one person to another. The closer you are, the higher the risk. Inside, we know that it's more of a likelihood for it to linger, right? And it's just more contained. Therefore, the risk is that much higher. But Chris, again, you're the expert here with respect to this. So I'd love to hear your opinion as well.
I wouldn't refer to myself as the expert, but thank you. A few other things to add. The mask reminds you not to touch your face. Even if you watch us all on this call for the hour or so that we're here, you'll notice people touch their face, their eye, their mouth, their nose several times. If you have your mask on, it stops you from doing so. Another thing, the closer you get to a friend, an acquaintance, the more likely you are to shake their hand, touch them, maybe even share a drink. I've heard of people accidentally say that they pulled their mask down to drink their drink, then put it back up, and a friend said, "Taste mine," and they accidentally tasted the friend's drink. So the mask is definitely a reminder. Hand washing is still very big. It's a very big preventative as far as keeping yourself healthy. So if you can remember to wash your hands, stay 6 feet away. No, you don't have to wear your mask. That's what the state is saying, but it's so unlikely that you can remember to stay 6 feet. Keep your hands away from your face and away from your friends. I just keep the mask on as a reminder. It's really your best protection because you will inevitably put your hand to your face, your mouth, your nose, your eyes.
And to follow up on that, from a public health perspective, because this is really the approach that we're trying to take here, right? To maintain the health of our residents. And when you're thinking of pandemics, you probably have heard these terms. There's this issue of containment, the containment phase, and the mitigation phase. And clearly, we weren't, based on when we started, we were not able to maintain that containment phase because at that point we couldn't find every single person who was infected and contact trace and quarantine, which would have been the ideal. So when there was community spread and there was evidence of that community spread occurring, then you had to rely on a combination of the two, this aspect of mitigation and containment. So that aspect of relying on social distancing and the use of masks is necessary to maintain this pandemic. And the other part I think that I've noticed in my work that people have had not been as aware of is it's not so much the rate of infection and who is getting infected versus others, and this is the disease of the elder versus not, but really the other piece to think about is that aspect of capacity to treat and putting providers at a position to have to make difficult decisions. So we are now at the point where you're seeing all these rates starting to decline and that ICU capacity decreasing across the hospitals. But if we are able to maintain this aspects of distancing as needed and mask wearing, then we're able to maintain that at a reasonable pace.
Great. And Eric, I'll add one more kind of concluding thought to this. Just from a personal perspective, I've noticed that on occasion, if I'm out and I'm walking my dogs and I don't have a mask on because I have always been able to maintain a 6 foot minimum spacing from everyone else around town, there comes an occasion where I'll walk past the store and somebody says, "Oh, hey, come on, whatever." And you just kind of drop your guard and I'm not thinking about it. And I start to like shake their hand or get too close. If I have the mask on, the mask is it's a very strong signal to my brain to be aware of what I'm doing and not break the rules, to use a simple term. So the mask is kind of, as Christine said, it's kind of a it's a mental check on all the habits that we've developed over a long time, and we've got to try to restrain them. So the mask is helpful. It's really helpful from that standpoint. So back to, is social distancing really necessary when wearing a mask? In I guess a literal sense, no, but as Dr. Perez explained, you have to put this in context. You know, how close are you to how many people for how long? And whether you're, you know, even if you're wearing a mask, if you are too close to too many people for too long, you've really increased your risk. All right, I'm going to move on to the next. That was Deb's question. We have another question from Erica. I'm going to read Erica's next question. Given that, how does the Board of Health feel about the new guidelines for school in the fall? Oh dear. Eric, I'm going to preface this by something. The Massachusetts Department of Public Health has been very outgoing and extremely helpful to our local boards around the Commonwealth with all of the guidance and help and advice that they've provided. But right now we are up to something like order number 45, I think it is, that the governor and the DPH have issued to deal with COVID-19. And there comes a point where it just becomes very difficult to constantly stay current with all the details of all of the orders and guidance that the state's issuing. And you have mentioned here, how does our board feel about the new guidelines for school in the fall? I have to confess, I haven't seen those new guidelines yet. I've been trying to cope with some other guidelines on other issues, but I'm going to ask Christine or Dr. Perez, have you seen the new guidelines for school in the fall from the DPH?
I've seen some versions of them. I'm not sure that they're the finalized ones. I guess I can speak to what I've seen and what I've heard people discuss, which may be related and not so. And Erica, I have to say, I mean, I'm a parent. So whenever I'm making, I have an 8 and a 10-year-old, rambunctious, lovely kids. So whenever I'm contributing to any feedback or input I'm giving to the board, I wear my parent hat, I wear my researcher hat, and I wear my hat as a psychologist. So I truly am sensitive to all the consequences this pandemic is having on an individual, on a family, on an economy. And thinking particularly with regards to your question, I feel a lot of sadness because I struggle with thinking about, well, this is going to be a huge change for children who really strive on continuity and normalcy. With that said, I also appreciate the need to think about how do we consider the risks and how do we keep the risks low and also maintain things moving forward. So I don't know that I have the answer now. And what we've learned more than anything with this virus is that we're constantly learning something new. So that is why what you may have learned back in March is no longer the case in April and is no longer the case in May and June and probably so on. So I don't know that these guidelines are going to stay, likely so, but I recognize that, I think it's important to validate that parents are going to have a tough time with this. I will, and I know my children will. And I think one of the things that I hope that we can do as a community, and I'd be happy to help discuss this is how can we address the emotional well-being of our children in this time.
Yeah. Okay. And Erica, you're asking good questions here. And I'll just follow on to that with the notion that Dr. Perez pointed out that we are constantly learning new things about COVID-19. And think about this for a second. This burst on the scene back in February. So February, March, April, May, we have 4 months of experience with this novel coronavirus. And initially it confounded the experts with how transmissible it was, how contagious it was, how deadly it was, how difficult it was to understand all of the symptoms that victims presented to doctors, and then how doctors tried to treat patients. It has been a constantly evolving situation. And as Dr. Perez said, we're learning new things about it every day. We just don't know all there is to know about it. So in that context, the guidance that the state is under tremendous pressure to make certain what the future is going to be. And that's a real dichotomy between trying to help us all understand what the future is going to be against the background of a virus that's constantly confounding us, that's presenting us with new and different problems every day. So I appreciate your question. It's a really good question. And at this instant, I guess, how does the board feel about them? That's a really tough one to answer right now. I don't know. I'll put the question, Christine. Do you want to add any of your thoughts on this also as a parent?
It's 2 months away. Truthfully, we've come so far. I've been thinking as far as quarantine periods. It has often been 14 days. We haven't gotten to discuss it yet as a board, but it was just an initial thought. What about making vacations longer, a 14-day vacation to stop that complete spread once the children do go back and get back together? Will they be wearing masks? I have no idea, quite honestly. Dr. Perez said we're learning so much. Initially, we didn't understand that a patient's best care would be in the prone position. You don't see anyone go on a respirator and go on their stomach. It's so rare. So they've learned that during this. I have this piece of me as a parent that I would love for them to go back the way things used to be. I have a junior and a senior, and will it ever come again? I don't know. Will they get used to this newness of a mask and try not to hug your friend or get excited and, sit closer, put your desks all closer together, make a talking circle or a group project circle? I think that's one of the great pieces that children learn in school is work together and closer. I don't have an answer at this time. It's really changed so quickly that it's frustrating, to be honest.
Yeah. Okay. Eric, I'm sorry we can't give you a better answer to that question, but I guess we'll just have to stay tuned. I'm going to move on to the next question. Is from Chet. Christina, this one I think is going to be for you. How and where can I get tested? That's a good question.
So there are quite a few testing sites locally. Unless you speak with your physician and discuss some type of symptomatic I still don't think it's your best idea to go asymptomatic with curiosity and get a test. The tests still are not that accurate. However, if you have been notified that you have been in close contact with a positive case, there are sites all around. There's AFC Urgent Care in Beverly. There's plenty of CVS's around that will test. And if you have been notified by someone, myself or any of the Hamilton tracing nurses, you would receive a call and then a letter that says, I need to be tested as I have been in contact. Other than that, I hate to say that it can almost be a waste of your money. There was a recent test.
Christine, I'm going to stop you there. I think for everyone who's listening in, this is an important point of information education. Tell us about what happens when you get notified that someone has tested positive for COVID-19. Could you walk us through the process that you have to follow, and in particular focus on this business of close contacts? How is that defined and what does it mean?
So I receive a result that someone is positive. I call them and ask them who and when were they in contact with, for how long. They then try to recall and give me a list of individuals who they have come in contact with in that parameter that we discussed. The biggest piece is when you're pre-symptomatic, you're the most contagious, which is the 48 hours prior to your symptoms coming out. I've called people and they've had a bit of an angry feeling when I say, someone gave me your name that was positive, and they say, who gave my name? And I try not to divulge this. This is against HIPAA. And I just ask if they would go and get a test and for 14 days, quarantine themselves and be aware of any potential symptoms. Quarantining yourself would mean wearing your mask if needed to go out in public, gloves if possible. Try to not, depending on your situation, share a bathroom with family members. Try not to be the person who's making the meals. If this is impossible for you, then you try your best just to keep your hands washed and keep your mask on.
So, Christine, the state just recently issued a test authorization form that allowed, up till now, a primary care physician order was essentially the requirement to get tested. And what that meant is, in effect, you had to present to your PCP with symptoms to get an authorization to get tested. However, now I believe you can issue paperwork that authorizes a test, right?
Correct. In the past, these test sites knew that the governor's order was out there. They were somewhat hesitant to do the testing. So I had worked with individuals and the sites that they were visiting to call the site myself and say, Joe Smith will be in and you are to test him per Governor Baker's order because he has been in contact with a positive case.
Yeah. Okay. So, Chet, the question, how about getting tested? It's a matter of, I think it's probably not possible for you to decide on your own volition, I want to get tested, so I'm going to get tested. I think two things now would have to, one of two things would have to happen. Either you would have to develop symptoms and contact your PCP, who would then give you an authorization to get tested. Or if it turns out that you were if either you were told you were in close contact with an infected person, or you thought you were in close contact with an infected person, then I think you could get the necessary authorization to go get tested. And as to where, the state now has on the website, the DPH website, a list, maybe a map of where all the testing sites are, and you type in your zip code and you can find out where the nearest one is. I think, and for us, the nearest one is in Beverly, right, Christine?
Yes.
Okay. So, Chet, I hope that answers the question. So, contrary to what I guess you may have heard from some people, if you want to get tested, you can get tested. It's not true. There are some circumstances or conditions that have to be met for you to get tested. So let me go to the next question. Joe, you have a thought you wanted to offer?
It was back on the previous question. I just, in listening to you all explain, I just want to try and share a thought that, I think that every time we get new guidance out and there's new information from somebody at the state, I think we all kind of take a second, is this the best thing for us? I think back to at the very beginning of this, I think it was Dr. Fauci or somebody high up had said, we've been asked if some of these restrictions that we're trying to put in place are overreacting. The truth is we might never know if we're overreacting, but we'll definitely know if we underreacted. As somebody that works in your town, trying to do the best we can for everybody in the town, we have to recognize that there's different levels of comfort with how people move around, how people interact now, and our job in government and with the boards of health is to take in as much information as we can and do the best that we can to make the most amount of people feel comfortable and allow things to kind of work themselves out. We're trying to protect the healthcare workers and the healthcare system from being overwhelmed. We're trying to protect the individual people. Like Giselle and Christine, I'm a parent as well. I'm going to have to make accommodations for whatever the new normal is in school when it starts again in September. We're very much aware of kind of the challenges that all of these kind of decisions make, but we don't know for sure 100% that anything that gets put out is the 100% best thing to do. We're just making the best educated guess we can, and hopefully, and so far what I've seen is the state's been able and willing to make adjustments on the fly. If they move in a direction and they need to make a change, they've been willing to do that. They've been supportive of the towns that try to do the same thing. So I definitely understand that there's frustration and anxiety about some of this stuff. I just hope that people understand that we're all doing our best and trying to consider all people's perspectives on the best way to move forward when these things come out. So I just wanted to share that. I'll stop taking over your meeting. Sorry.
Thank you, Joe. And I'll share one last personal perspective on this. A couple of days ago, I had my annual wellness check with my primary care physician. And she said to me, you're one of the first patients that I've met with in the last 3 or 4 months, because I've been part of the leadership team that Partners formed to try to figure out how to plan for this pandemic, how to avoid getting into a position like the medical community in Italy faced, where literally doctors were faced with a question: which patients do I try to keep alive and what patients do I let die? And the hospital system in Massachusetts, I think, did a really good job of managing this pandemic, and then specifically flattening the curve to keep our healthcare system from being overwhelmed. So the medical community and the state really deserve a lot of credit for having avoided that kind of a horrible situation that others are, and some other places we know have had to face. So let's see, I'm looking to see if there's any more questions. Okay, Erica, thank you. I think at the moment, that's the end of the questions that I see posted. Let me think for a second. Christopher Small, is there anything you'd like to point out to, bring to the attention of everyone who's listening that you think they might like to hear from your perspective?
Well, I think that I think people are relaxing as we move into phase 2, and I think people need to be vigilant. And what I'm seeing, this is anecdotal, but what I'm seeing when I'm out in the world is that people are not social distancing, not maintaining a 6-foot distance. They're not wearing masks when they're required to. And whether that's Crane Beach or Patton Park on the playground today, people need to be reminded gently and in a supportive way that they just have to wear their masks, and they need to social distance, and they need to remember that this isn't over yet. And things are changing, and we're relaxing some of the norms, but it's way too early to be for not wearing one's mask.
Christopher, you must be prescient, because I'm going to read the next question here. What are the board's concerns that the loosening of restrictions will lead to a second wave?
Well, let me just say one more thing, and that is that having been on Crane Beach daily, I've seen, and one of the lists of the COVID-19, the Crane Beach COVID-19 rules is if you're walking on the beach, you wear a mask. Well, at this point in time, I would say that 95% of the people who are walking on the beach are no longer wearing a mask, whether they're close to the general public, where most people are camping out on the beach, or whether they're far away. And once you're far away, I don't have a problem if you're not wearing a mask, if you're a mile down the beach and there's no one else there. But people are quickly pulling their masks down, or they don't even have a mask with them. It's kind of remarkable. And today, driving by the playground, I was astonished at the number of children and parents who were just tumbling all over the equipment in joy, and understandably, but not wearing masks. And there were 6 or 8 young guys playing basketball closely together, not wearing masks. And that, of course, is, we have not opened the basketball courts, but nonetheless, we've got an issue there which we have to resolve. But I think people, they're tired of this. It's understandable. And we're all tired of COVID-19, but it's way too early to relax and not be vigilant. And we've got to remember what 6 feet means. We're already 6 feet means 3 feet. It's, really, I think we need to put a sign in Patton Park that says, maintain this distance. It might help. Enough.
Josh, I think there's two levels of response to your question. I think, personally, as Christopher has just articulated, after having been cooped up for 3 months or more, I think a lot of people are experiencing cabin fever, and with this nice weather, dying to get out. And so all the restrictions that we have successfully followed are now kind of falling by the wayside. People are forgetting. People are getting they're getting caught up in the moment. And so my fear is that we're going to experience a second wave here in the second half of June in the form of, transmission of the virus as a result of the fact that we have suddenly kind of, we've sort of forgotten how we're supposed to behave. And so that's going to create a lot of new infections and illness. But the second wave, I think you're probably referring to.
These are guys. Which one?
It's what happens when the virus resurges sometime in the fall or winter, as traditionally happens with flu season, peaking in the winter. That second wave is probably 6 months away. I think the first, second wave is probably a couple of weeks away. I hate to say it, but that's.
Yeah, I wanted to sort of contribute because I think, so this issue of a second wave, it's in a sense almost imminent, right? I guess the best way to consider this is if we let go of everything we've done so far, we're back in March. So if we have been feeling the sort of issue of being contained and having all of these restrictions, and then now that things are opening, if we get to the point of being back in March, then at some point things will have to close again, right? Because if we get to the point where the hospitals are overwhelmed, that is where a big issue lies. So that's, I think when I consider, oh my gosh, this is impacting me, because it is, and it's impacting me and my family. But when I'm thinking about, well, what happens if we just let go? What happens if we just decide to not wear the masks or to just no longer socially distance? Well, the virus is still there. It hasn't gone away. We don't have a vaccine and we don't have effective treatment. So therefore, if we don't do anything to maintain it now, we're back at square one. And that's not where I think we want to be. So yes, we are trying to prevent that second wave, but I will say that there is enough talk in the research and clinical medical community that there is concern that that's sort of likely to happen in the fall. And the biggest concern is that in the fall is where we're seeing the flu season also happening. So what we don't want to see is sort of the interaction of the two. So where you have an increase in flu, especially if there's a decrease in flu vaccination, in addition to this COVID-19, that would be a huge mess. So that is one of my personal concerns.
Thank you, Dr. Perez. We've got a series of new questions here from Mary. Here's a question. Are the playgrounds now officially open? The Hamilton Wenham director of what is Sean Simmons' title? Activities, whatever.
Recreation director.
Thank you, Joe. The recreation director has been struggling with this for weeks, and I believe today was the day that under phase 2, playgrounds I think may officially open, but every one of these, yeah, we're now open, has a but attached to it, but with restrictions. I may be wrong. It may be, it opened yesterday, it may be today, it may be in a week. Nonetheless, playgrounds are either already open or going to be open soon with restrictions, and the restrictions concern family units versus non-family units, concern distances, social distancing, concern masks, and all of those things. And the details are on the DPH website, the Department of Public Health website, where you can scroll down and find a particular topic of interest, and playgrounds, of course, is one. And I think I think I have it on my hard drive. I think I just downloaded it today. As I mentioned earlier, this is the 44th or 45th new order directive from DPH, and it's just really hard to keep track of all of them and keep current on all of them. But Mary, I think the answer to your question is either yes or almost yes. And the simple answer is, if it's open already or if it's about to open, it's with conditions, and you have to read the fine print of these conditions to see how you may, I don't know the word, officially use playgrounds.
David, can I jump in for a second?
Yeah, please.
I do believe it's today, and the main two restrictions, if you want to call them that, are social distancing and mask wearing.
Yeah.
And those are the two things that are listed in the governor's the two main things. And obviously there are others, but I believe it was open today. But again, that was one of my concerns when I saw folks out.
May I also offer? I've talked to Sean about this a little bit. One of the other things is that public playgrounds and parks. One of the things that Sean's struggling with is there are some regulations or requirements to clean bathrooms, public bathrooms, like every hour, or every so often. It's going to be really difficult to meet that burden. So there's a lot of discussion about if we open up, do we open the public restrooms or not? And I think that there was some restriction. I just asked Sean via text if he had time to jump on, because he obviously has read them and is trying to prepare for it. I haven't heard back from him yet, but he did discuss too some need to clean the playground equipment on a fairly regular basis, disinfect the playground equipment again, which is a very high bar for a town our size to manage. We don't have a budget for that kind of stuff. And how long do you keep it up, and how do you ensure that it gets done in a way that people feel safe? So we're not really sure about that. It's not just the mask wearing and the social distancing. It's the use of common equipment that has the state plussed. So I will ask Sean to follow up from this meeting by putting together some written information that we can post on the town website and share through social media for folks.
Joe, thank you. I appreciate that. And if you see Sean come on, let me know. But so Mary, the simple answer is I guess yes, but the sticky part comes in under what conditions, and that's what our recreation director has been struggling with over the past couple of days and a week, knowing that it's going to come with these conditions, and how can he reasonably comply with those conditions? How do we communicate to parents the fact that it's okay if you take your children to the playground, to use the playground, but you really have to avoid mixing with all these other families who want to use the playground? And all it takes is, one person who is infected with the virus in close quarters like that to transmit it to everybody else. So that's our concern. All right, a question from Christina.
Can I just add a piece in? Sorry, David.
Go right ahead.
If it were myself that had children to bring to the playground, I would likely advise stay for no more than an hour so that your child doesn't need to use the bathroom. And if you could, not bring a snack with you so that you can go home, wash your hands fully, sing your happy birthday song, wash your hands, and have your lunch and your drink. The germs really you come in significant contact with germs once you're bringing the hands to the face when you're eating and utilizing the bathroom. So if you could, toilet, have your children use the toilet prior to the playground, go for an hour, and then go back home, give your hands a good wash, and have your snack. And I would say that's your safest way to use the playground. Thank you.
Thank you, Christine. Here's a question from Christina. With beaches allowed to be open in phase 2, what is the reason is to be compliant with published state guidelines of frequent cleaning and not disinfecting the actual. Okay, Cindy, let's wait until our recreation director is going to come on the call here in a few minutes. So Cindy, we'll ask him to tackle that question for you. Next, we have a question from Deb. Given our knowledge that people critically affected by the virus are health compromised by either age or pre-existing immunity issues or the like, can we focus public efforts on protecting the vulnerable rather than a one-size-fits-all restrictive guideline or guidelines? That's an interesting question.
Can I address
Dr.
that?
Perez, could you tackle that for us, please?
I'll start, but I think it's definitely something that we all should contribute to that. I think, Deb, that's a really great question. And if we had a way to do that, I'm sure, that would be the ideal. But when you're thinking about COVID-19 again, yes, you're right with respect to the critical death that is highly impacting the older adults. But when you're thinking about just general impact, who's affected, who's hospitalized, the rates of hospitalization are actually across the board by age. Certainly, there's a lot of variation in rates depending on how old people are, but it's not unusual to see people in their 50s, right? So I consider 50 young, actually. So people in their 50s are being hospitalized. And then also when you're thinking about comorbid chronic conditions, things like obesity, cardiovascular disease, asthma, diabetes, those are all conditions that are individuals who are impacted by COVID-19. So therefore, if you really take that into consideration and knowing what those rates are like in our society, and those are the high rates of our public have those chronic conditions. So in essence, it would be really hard to isolate one individual because everybody is essentially at risk. And then when you're thinking about public health is really, the idea is to maintain the health of our public. So knowing that it's hard to isolate one person or one group, and knowing that this is vastly able to impact a high number of individuals, and knowing that even if we were to try to isolate one small group, that everybody is likely to have the same risk of being affected and therefore having to go and be hospitalized, and we still run the risk of overwhelming our hospital system. That is why I believe these precautions are taking place. So that's my opinion.
Yeah. Again, Deb, that's a good question. And I think that Dr. Perez has pretty well elucidated the broader perspective on this. If you focus exclusively on the death toll of the coronavirus, yes, it has been predominantly people in long-term care facilities, people who are over the age of 80, and people who are compromised by some pre-existing condition. Okay, that's all true. But Dr. Perez is quite right. If you look at the data on hospitalizations, who is in the hospital as a result of being ill from coronavirus, it does span a much wider age range, all the way down to 40s and 30s. And so just because you're 30 or 40 doesn't mean you're not going to get sick. You can get sick and get very sick from this virus to the point where you're in the ICU. And is that really what you want? So we got to be careful about, just because the focus is on the statistics of the deaths associated with coronavirus being a narrow cohort of our population. You can ignore everybody else. You can't, because there's a lot of other people getting sick down into the younger age groups. Next question. From another question from Christine. Who in Wenham manages Pleasant Pond, the Recreation Department, the Board of Health? And that would be a follow-up to your question about Pleasant Pond still being closed.
I can answer that, David. It's the one. Sorry, yeah, the Wenham Police operate Pleasant Pond. Wenham Police.
Sean, introduce yourself, and I'm going to pose some questions to you that have come in here.
Sure. So it's Sean Timmons, Hamilton Wenham Recreation Director.
Okay, Sean, some questions for you. I'm going to read a couple of them. Let me get through them first and then ask you to address them. Are playgrounds now officially open? I think let me put that question to you first. Are playgrounds officially open? And I said, I think yes, but under some detailed conditions. So think about that for a moment. With beaches open in phase 2, why is Pleasant Pond closed? Okay, we'll pass on that for a moment. Please comment on how the equipment in the playgrounds is to be made compliant with published state guidelines of frequent cleaning and not disinfecting the actual surface areas. And okay, I think that that's enough for you to tackle. Sean, go
Yeah,
ahead.
sure. So I can hit on the playgrounds first. So correct. Playgrounds, as part of the state's plan in phase 2, can reopen. But I think someone had made mention of the compliance that needs to be in place. So playgrounds can be open with daily disinfection or daily cleaning. So I think that's what most towns right now, in regards to playgrounds, are kind of battling with. The town employees or town staff or just towns in general don't really have the bandwidth to be able to clean or disinfect playgrounds on a daily basis. That would probably be something that maybe a DPW staff person might do. But with reduction in staffing and just really, the not being able to do it on the weekends and things like that, it makes it really difficult. So most towns currently still have restrictions on their playgrounds, and most towns playgrounds are actually closed because a lot of us recreation folks are trying to deal with, how exactly are we going to disinfect the playgrounds every day, and specifically on the weekends when we don't have town staff there. I think towns are starting to shift and just having folks use best practices on the playgrounds. So that might be something that, that Hamilton and or Wenham, would consider. But right now, the town's restrictions are that the playgrounds are closed, but the state restrictions are that playgrounds can open, but with daily cleaning. So, it's just another, it's really difficult when we don't have a lot of advance notice of when we're going to be moving into these different phases to be able to get all our ducks in a row to be able to open things up like the playground. So as of right now, playgrounds are closed townwide, and that was the restriction that you had made at a meeting, the Board of Health, had made at their previous meeting, maybe about a week or two ago. But certainly now that the state is in phase 2 for reopening playgrounds, that's something that that the Board of Health could consider. That being said, those guidelines of the daily maintenance and the daily cleaning would be pretty difficult, for any municipality or any town to adhere to.
Sean, could you touch on another related question, and that is, let's take bathroom facilities at either Patton Park or Pingree Park. How will those be managed?
So again, that's something that we're currently working with the DPWs, and that again is tough because town staff cleans the bathrooms, and we won't have town staff obviously on the weekends. So that does pose some challenges. The other option we have, and that I'm exploring, is can we get portable restrooms that can be cleaned every day? It's difficult for the portable restroom companies to come and clean every day. Usually they do a weekly cleaning. So those are items that we're wrestling with. We hope that youth sports, as the restrictions start to loosen up, that we can get youth sports back in some semblance in town. But we do want to be able to provide those folks with bathroom opportunities. So that's something that we're currently looking at right now with the bathrooms.
Okay. I'm going to ask everybody who is on the Zoom call, if you have questions that you think Sean might be able to address, please go ahead, unmute your microphone and go ahead and ask them. Okay. And just a point of clarification, did I understand correctly in response to, I forgot, what was Christina's question? Maybe Joe, you answered, who manages Pleasant Pond in Wenham? Who's responsible for opening and closing Pleasant Pond?
Sure. So Pleasant Pond is historically and is still run by the Wenham Police Department. I know that that it's a struggle with beaches, specifically small beaches, like Pleasant Pond, with parking and with beach space. Certainly, I think it's, the restrictions are groups of 9, but the groups of 9 have to be 12 feet apart on beaches, I believe. So I think those are all things that they're looking at. And certainly there's obviously, when we talk about any of kind of recreation facilities or anything moving forward, especially now, there's obviously, financial implications that come with all of these things that I think, Wenham is currently exploring. I don't want to speak for Wenham, but I think to the best of my knowledge, that's the I think the thought process there.
Okay.
Hey, Sean, this is Josh Rollins. Did I hear that Little League will be happening this year?
So again, those are things that, as restrictions loosen, I think we'll start looking at those things right now. Even though the state is in phase 2 with groups of 9 and, individual play and things of that nature, the town itself needs to loosen those restrictions, but certainly, in phase 2, for the state's plan in phase 2, you can have practices no more than 10 people, which include a coach. Spectators are, or what they call chaperones, are limited to 1 per person. So, if my son or daughter was playing Little League, either me or my wife would have to go to be in attendance. The both of us could not go. That right now is what is in the state's guidance. Phase 3 for the state, from everything that we've read and been told, games and things of that nature might be able to take place in there. So I know Little League had reached out to participants to kind of gauge interest. And I believe, from everything that I've been told, is that they're working on a kind of a reopening phase of their own, or a back to play phase of their own.
Okay. Sean, someone has commented that the Hamilton Wenham Little League is collecting parent survey results.
Yeah.
So,
yep. I think they're just gauging interest. Certainly the season, would have been over soon, in mid-June. Yeah. So I think just trying to re-gauge everyone's interest to see if they're interested in playing. Okay. But, from everything that I've been told by Little League, I think they're looking to resume some sort of season this summer.
Okay. Sean, here's another related question. Lorraine has asked that she's heard there's a survey coming out about the pool.
So I'm working on.
Can I take that one? I just want to, that came out of a conversation at the Board of Selectmen's meeting last night. Sean made a presentation to the board based on our projections that if, given the restrictions on the way the pool has to be operated, that if we were to open the pool this year, we will operate at a deficit. That is against state law. We actually had our finance director reach out today to talk to the state to see what could be done. It's a difficult issue. We had a good discussion with the Board of Selectmen. Some members of the Board of Selectmen want us to see if there was any way we can open, despite the fact that we'd be projecting quite a large deficit. And kind of given we had agreed as part of our research for them before making a final decision on the pool, we would try to do a survey. And I think I asked Sean today to work on some survey questions that we may put up tomorrow. But given the news that I got from the state today and our expectation that there'd be no way at all that we could legitimately say that we could operate the pool at break even, we would be in a difficult position to make the recommendation to open the pool. Quite the opposite. It would be my fiscal responsibility to not open the pool. Revolving funds, like the pool is operated on, are not allowed to operate in deficit, and they can cause the town quite a bit of trouble if we were to get into that habit. So we may put out a survey, but there's a lot of factors to consider. We have a partner in Wenham in the way we manage that pool. Wenham needs an override just to balance its budget this year. So asking them to take on a known deficit and a revolving fund that we know to do so would be illegal, it seems like a pretty big ask as well. I had a short conversation with the town administrator there today. I don't want to speak for him, but he is in agreement with me that it doesn't make sense to recommend opening the pool this year. The restrictions that were put on pools, Sean will clean up the numbers, but I think it's something like 40% of the capacity of the pool. He'd be able to open up in an hour and a half a time for reservations to handle 30 people at a time. And then after an hour and a half, you'd have to close the pool for 30 minutes to disinfect so you could open up for a new group of 30 people. And then if we got all of our time slots filled at a variety of different price points that he time tested, we pretty much could guarantee that there's no way we could make that revolving fund break even. And again, state law requires us, if we're operating a revolving fund, that it handle its own expenses. So to me, it's not looking good for the pool this summer. I just want to be clear about that. Even if there's a survey out, I don't want to get people's hopes up. The idea is that we're just trying to test to see what people's willingness to pay would be, but it would be quite a high number, with $14, $16, $18 per person for an hour and a half on a drop-in basis. And then we'd need to sell out all of those time slots. So I don't think it's really likely. But I'll let Sean answer the more meat and potatoes part of that question.
Thanks, Joe.
Yeah, Joe, absolutely correct. I mean, you hit the nail on the head. So the state guidelines that just were released do limit our capacity to 40%. That also includes our staff. And we do need to have extra staff on board to be what the state refers to as social distancing coordinators. So our lifeguards would obviously be watching the water, but we would need to have additional staff to make sure that folks were keeping socially distant. You know, one thing, guideline on the pool that I was a little surprised by, and where it really differs from the beach. And we talk about the beach where it can be a group of 9, which I still believe is the case, a group of 9, and the next group has to be 12 feet away from that group of 9. Well, in the pool guidelines, it states that any groupings need to be the same household. So that's a difference that between the beach regulations and the pool regulations. So when we would take reservations, it really, it really kind of limits kind of the mixture of groups or the types of reservations that we could potentially take. One of the great things about, our pool, when we're up and running normally, is we have a lot of kids riding their bikes. We allow residents who are 11 years or older who pass the swim test to visit the pool by themselves. So that is something that would not happen, this summer based on those sort of guidelines. We couldn't have 2 friends come to the pool together and sit in the same area because those designated areas need to be households. So, we're certainly not the only municipal pool that is going through this and wondering whether or not it makes financial sense to operate. But Joe was correct in everything that he said there.
Sean, here's a further question that tangentially affects you. Dean has asked, any thoughts as to when the library will reopen? And is that going to be before, after, or the same time as the rec center reopens? So let's start with the rec center.
So we're currently working on a plan to open the rec center. Right now, adult sports cannot be played indoors. And what we're doing with our programming for this summer, folks probably know we did cancel the large park program at Patton Park just due to those guidelines and restrictions. But what we are doing is we're creating outdoor classrooms or in outdoor activity areas at the rec center, and we're currently working on programming that we're going to be offering this summer. So for the programming this summer, I'm going to do my best to keep everything outside, and then kind of await more guidance from the state about indoor activities. But right now, based on phase 2 of the state's guidelines, only youth activities can take place inside, and of course, socially distanced. So, I would think of it of a basketball clinic where you had a coach and then the players were spread out. Something like that we could do inside, but any adult sports or anything of that nature is not allowed right now in phase 2. So, So we're going to try to do most of our programming outside this summer, and then kind of slowly reopen the recreation center for more indoor and reservation type activities, as we get into the summer. And as far as the library goes, I know right now that they're offering curbside pickup. The library is a joint department, but that's run by the town of Wenham. The recreation department is run by the town of Hamilton. The library is Wenham. And I know Wenham Town Hall is not open yet as well. So I'd assume that, Wenham is probably working on an opening plan of their own, which would include the library.
Yeah. So Dean, on your question on the library, that's one near and dear to my heart. And I'm anxiously awaiting it to reopen. Kim Butler has been struggling with this for, weeks and months, and I know she's anxious to get it reopened. I have to look into this myself. Sean's right. I understand there's now a curbside pickup arrangement that's possible. So I guess what I'm going to recommend is check in on the Hamilton Wenham Library website and see what information you can glean from that. And then just stay tuned for when and how it's going to be reopened. Okay, Josh has a question for Christine. Christine, I trust you're still on. Could you clarify the current town numbers, 35 total cases and 4 that are being actively tracked? Does that mean that the other 31 cases have been resolved?
So 36 confirmed positive. That means whether they were in the past or I'm currently working with them, that's just a total number of people that live in Hamilton that are definitely positive for coronavirus. As far as people that I'm in contact with or the nurses I'm working with, currently there are 4. And this means that there are 4 people that for whatever reason, we need to be on a fairly daily basis, whether it's a person in isolation or a person that is a contact of a positive case. I can't break it down for you in that explicit guidelines, but it's 36 total confirmed, and then 4 currently are in progress, people that we are working with.
And so, Josh, a follow-up on that. Does that mean that the other 31, it's actually 32 cases have been, quote, resolved, unquote? So, Christine, could you clarify that question?
So, again, out of the 4 that we're working with, say I could be speaking of 1 positive and 3 contacts, or I could be speaking of 4 positive with no contacts. I didn't break it down that significantly, but most of the 36 are people that are in the past. And so when I refer to the number that we're working with, if you were to say, okay, how many are currently positive right now, you could pretend it was 4. I don't have those numbers as far as, are we working with 1 positive and 3 contacts, 2 positives and 2 contacts? I didn't break it that precisely down, but the total of confirmed is 36.
And Christine, just to follow up from me on this question, the very first positive case that you got in Maven was roughly when? Was that in early March, maybe?
I would say right around early March. But our very first positive individual
representatives.
I'm getting a lot of feedback. Our very first positive case was an individual who on March 13th did not feel well and went into the feedback.
I'm there, but there's no place to.
D Sargent. Oh, there you go. Could you? Yeah, okay. You just muted. That's great. I will come back to you in a minute as soon as Christine is finished. Okay, so hold on.
So the individual on the 13th that was positive was taken to Beverly Hospital via ambulance out of our one of our pharmacies in town. And I only received that positive result 1 month later, because the very first positives were being sent to California, the tests. And the amount of time it took for the test to get into the state database and then come to me was, I believe, 4.5 weeks. And we literally had coronavirus here in town. And the case, when I spoke with the individual, they said to me that they actually had to speak to the physician in the emergency room and say, I would like you to test me. And the physician said, you don't go anywhere. And they said, my symptoms are all in keeping, so please test me. And the person came back positive. So it was way before we even knew that it was here. We had cases.
Yeah. So, Josh, I guess the gist of this is that we have had 36 total cases. That's the cumulative total from day one.
Mm-hmm.
And I think it would be fair to say that of those 36 total cases, if we assume that 4 of them, not necessarily true, but 4 of them are being actively tracked and they're all positives, that would leave 32 people who have been infected with the virus and who, well, most of them survived, but some of them didn't.
Right.
Correct, Christine?
Correct.
Yeah. The ones who survived then presumably have immunity. And so the using the word resolved is a little tricky here in this case. The 32 cases that are not being actively tracked, some of them actually have died, and the ones who have not have recovered and presumably have immunity. So that's a little bit of a tricky one to answer. Let's see, another, okay. Here's a co-host capability. Okay, here's a question from D. D's question, I guess, Christine, for you, are the 7 deaths that you mentioned from COVID-19, are they included in the 36 positive cases, or are they in addition to the 36 positive cases?
So the 7 deaths only, now I have to think exactly, I believe only 2 people were living here in Hamilton, and others were in a long-term care facility, but their primary residence is listed as Hamilton on their death certificate. So I've received via word of mouth or by the Maven tracking, the state tracking app for infectious disease is called Maven. I've received deaths, but I have not received a death certificate through the town of Hamilton. So in order not to overlap numbers, I cannot say that, oh, Maven has 4, I've just received 7 death certificates, therefore we have a total of 11. Because the way towns track the deaths are through whom is issued a death certificate for that town. Yeah. So another way to state it, if a person were in Masconomet long-term care facility and their residence is stated Masconomet, but they reside in Topsfield. Is it in Topsfield? I'm sorry, now I'm crossing. But so we've had residents in different long-term care facilities, Peabody, Beverly, and Topsfield. But if their primary residence does not say Hamilton, then it is considered to another town. Did that answer?
The answer is a little complicated, as you can tell from how Christine is trying to answer your question. It's convoluted, and it's a matter of intricacies of the state's data reporting into various databases that aren't entirely consistent. So it's hard for us to give a simple, definitive answer to your question. But from what Christine has explained, you can see how it gets kind of, it gets a little slippery to try to reconcile all these numbers. And if you wanted to reach out to her afterwards individually, that would be fine. So, okay. Giselle, I'm sorry, you're right. I'd like Dr. Perez to address the question that I was kind of, I glossed over a little bit, and that's the business of immunity once you've been infected and survived COVID-19. So, Dr. Perez, could you please tackle that question?
I don't think that I'd give a much longer answer than that's still up in the air. So based on how viruses behave, one would presume that once you've had it, there's some level of immunity. But I think right now the research community is still leaving that open because of the fact that we still don't know too much about this virus. So I was just the researcher hat, once you said immunity, I just said, no, there isn't absolute immunity because we don't know that for sure. Sorry.
I'm glad you caught me on that because you're absolutely correct. That is a subject of some pretty active debate in the medical community right now. No clear answer yet for sure. So, okay. I think I'm looking at my list of questions here. I think that's all the questions that I see on the list. Is again, if anyone is tuned in here on Zoom and wants to ask a question, this is your opportunity. So unmute your microphone and go ahead and ask.
David, I've got a question for Sean if he's still on. Sean, are you still with us?
Yep, I'm here.
Yeah, I'm just wondering what you think we should, how we should approach the whole playground at this point. I mean, the caution tape is down, people are using it. The state says it's open. We are in agreement that we closed it, but it was a free for all there today, So how do you think we should proceed?
Yeah, this is a tough one, and I know a lot of towns are struggling with this because if you were to open it, there's no way that we would be able to maintain what the state guidelines are, right? So normally the state releases its guidelines, we can review them, and then as a town decide, okay, we think we can do this. The tennis courts was a good example, right? We said we can open the tennis courts, but has to be singles play, only, you still got to be socially distant. So we can put those parameters in place. With the playground, it's hard for us to say, well, the playground is open, but we're going to maintain and clean it every day because that's just an unrealistic expectation. And that's not just a Hamilton item. That's statewide. I do know that more and more towns are now starting to open their playgrounds and just providing people with, best practices about hand hygiene, staying home if you're sick. And because in all honesty, and you kind of nailed it there too, is, the playgrounds are being used. And so I think, with that, it becomes a really, really tough decision because we're not specifically following the state guidelines. So, I personally, I'm not no health expert, that's for sure. But, I can tell you that I do believe in the next few weeks, or even starting as soon as today, I used to live in Wakefield. Wakefield opened their playgrounds today. That I do think that you'll see more and more communities starting to open the playgrounds simply because they are being used. So, as we open them, we can provide signage and we can do other things down there that we don't currently have. Promoting, all the kind of the social distancing and hand hygiene and things of that nature. So, it's tough as the weather gets nice. School is also wrapping up next week, so that I think kind of lends to maybe looking at it as well. And like I said, with school ending next week, I think you're going to see kind of a large influx of people outdoors, and the weather's been nice. So I know I didn't really provide an answer, but I think that's kind of, that's the tricky part. That's really the really tricky part with the playgrounds.
Thanks for that, and maybe we can address that at the next Board of Health meeting or sooner somehow. And,
Yeah, absolutely. And I'd be, willing to, hop on and, when we talk about the outdoor and the youth sports and, permitted use and things like that. I mean, that's kind of where right there, kind of this week, phase 2 started. So that would be kind of a logical thing to take a look at.
right. And we've also got the basketball hoops to deal with, which are, up
Correct.
and being used, so,
Yeah.
okay, thank you.
No problem.
Okay. Okay, I think that's the end of the questions. I appreciate our town management participating. Joe, Sean, Ray, thank you very much for joining in and helping us answer questions. We appreciate it. I appreciate all of our residents who've participated and asked a lot of very good questions that you can tell we struggle with to one degree or another. I again thank our board members and our public health nurse for their contributions. So I think, okay. Any parting thoughts, Dr. Perez?
I do want to say, to our residents, we really do care very much about our community, and any decisions or suggestions rather that we're making, we are trying to ensure that they have some empirical support, albeit there's limited out there because this is still new, but we're also taking into consideration the well-being of everyone. So no decision or no input is being made lightly. We're really aware that this is a difficult time, and I'm maybe an optimist thinking, this isn't going to last forever. There is going to be a long time of this, but there is going to be a change in the right direction at some point, and we just have to sort of come together and sort of have patience with each other and respectfully sort of give people the space to sort of make hopefully good decisions. And I encourage you all, certainly we want to be transparent. We don't want to inundate you with information because that's not helpful either. But, one of the reasons why we wanted to do this is to let you know what we're thinking and why we're doing what we're doing, and to allow you to ask the questions that you really need to have addressed. So please feel free to let us know. And I think this should continue to be a two-way street. But I just wanted to make sure to put that out there.
Thank you very much, Dr. Perez. Well spoken. Christine, any parting thoughts from you?
I agree with Giselle. This will not last forever. Be kind to one another.
Thank you. Okay. This was an official board meeting, I guess, so a different format, but so I guess we have to adjourn. And so I need a motion for the board to adjourn now.
I would like to make a motion for us to adjourn this meeting today.
Okay. Is there a second?
I second that.
Okay. Any discussion? All right. All in favor? Say aye.
David, don't forget you need a roll call vote on all virtual meetings. You need a roll call vote on all motions in a virtual meeting.
Right.
Just a reminder. Yeah.
I'm going to now do a roll call vote. David Smith, aye on the motion.
Giselle Perez, aye.
Christopher Small, aye.
Okay, that's unanimous in favor of adjournment. Thank you, everyone, and be safe.